Welcome to the Defeating Pain podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
Welcome back to this episode of Defeating Pain podcast. Before we can defeat it, like take it to the woodshed and let it know who's the boss, we got to understand exactly what is pain. And there is a whole new philosophy. There is a whole new treatment paradigm regarding chronic pain. Have you ever wondered why some people that got injured, and there's a predictable amount of time that goes on for an injury to heal itself? For example, there's a fracture. We know fractures heal in about 6 to 8 weeks. We know that muscles sometimes can take up to a year. Not that you're in pain, but by the time it's totally done with the reconstruction and remodeling, it can take up to a year. But why is it that some people, even though the healing period for that particular anatomy or tissue has come and gone, and they're still in pain? Why is it that traditional PT, or even after a surgery, that the surgeon says, this was a success. You've gone through PT, you've gone through maybe decompression therapy for a lumbar disc, you've gone through laser therapy, and yet you're still in pain? Because they're looking at it from a mechanical or structural. And the way that we need to start looking at things is more from a neurological standpoint. And that's what I want to talk to you today. This is why defeating pain, you have to look at it differently. You have to understand exactly what it is. And that's what we're going to go over. So what is pain? Pain is a warning system for us. It is when some kind of receptor, our muscles, our joints, our ligaments, there's a receptor that has gone beyond its limits and it's been injured. And that creates what we call a noxious stimulus. Now, pain is a subjective component. Subjective. I can't feel my patient's pain when they come in. It's purely subjective. It's what their experience is. But I can tell you what I do appreciate is that they are in pain. I respect they're in pain. I respect what they're perceiving as pain, even though I can't feel it. And maybe sometimes I can't even see it. All right. So pain is very subjective, but we always have to respect it. Pain is brought on because of a network of receptors in our body have been injured, or they've gone from receptors into what we call nociceptors, which are called pain receptors. See, our training and focus in chiropractic has been very much determined by structure and mechanical. And I shouldn't even just say in chiropractic. Physical therapy, pain management, it's all the same, is that the training focus has been on that bad structure, that bad piece of anatomy that mechanically isn't working. Well, the reason that you're still in pain after all these months, even though that structure probably is healed, is that there hasn't been a reboot of the nervous system. It's all about the neurological aspects of it. We know that pain is also an indicator of tissue damage in acute pain. So everything I'm talking about right now is acute pain. So when we see patients, we may see patients with tissue damage, but no pain. We may see patients with no tissue damage, but they're in pain. Well, that's just as clear as mud, right? What does that mean? That means that what I don't want you to become, if you've gone to your primary care physician, if you've gone to an orthopedic surgeon, you've had x-rays, and they say, well, you've got arthritis. Well, you've got degenerative disc disease, and that's what's causing everything. No. That's just structurally what's going on with you. That does not necessarily mean that is the cause of your pain. And see, that's what we're going to do in this podcast. We're going to whittle down so that you understand what is really the cause of your pain, and then what you can do about it at home. so that you don't have to go to office visits. There's a new shift in healthcare. Hopefully I'm leading that shift. I just don't believe that you've got to come to the doctor as many times as everybody wants you to in order for you to, one, get out of pain, and two, get moving. Or get moving and then get out of the pain. It kind of goes hand in hand. But the one thing that we try to do at the clinic is we have to de-educate patients when they first come in. We have to debunk the myth that, oh, I've got arthritis. Do you realize there's a lot of people that have degenerative disc disease, but they have no symptoms? This has been validated by MRI studies and a lot of research studies. You may have a bad-looking spine on an X-ray. That does not equate into being painful. So we've got to de-educate, and then we're going to re-educate you, and then we're going to reframe the conversation. We're going to change the conversation. We're going to make sure that you absolutely understand what's going on. So this is a weird looking thing, but it's up in our brain. It's on each side. It's called the sensory homunculus. And I'm not going to get too deep into the weeds neurologically with you, but it's very important that you understand that there is a map of all your body parts right up in your brain. And the information from your body parts, like your muscles, your joints, your ligaments, your tendons, they have to reach that part of your brain. So the brain knows what's going on. They understand what's happening down in those parts. Because if that isn't happening, if you're not moving well, then there's going to be a blurring of that area. It's called a brain internal model. Faulty information into that is going to be a faulty model. In other words, there's going to be smudging occurring right here on these different areas. When there is smudging, you get what we call a blurry brain map. That means the brain just isn't receiving the information. Think of it as a bad cell coverage area. You're just not getting the information in there. And so what happens is the brain lowers the threshold for any kind of pain. It doesn't take as much. You could just be walking out to the mailbox, and that walking movement, because you've been very sedentary, because you've been worried, you've been scared, you've been cautious of the fact that if you move, it hurts. And so you think, I shouldn't move. Well, what we're going to do is teach you that you can move. And we're going to show you the advanced therapies, neuromuscular electrical stimulation units that, yes, you can use right from the comfort of your home. And no, they will not break the bank. I can tell you, most doctors of chiropractic and most PTs don't even know these things exist. Okay, because they're still hanging on to outdated protocols. And that's a travesty to me. Okay, because there's too many of you that are out there hurting and you don't know where to go. Well, now, hopefully, you keep following me along with this Defeating Pain podcast. You're going to get the information you need and start getting your life back. We know that when you're in pain and you have a lack of movement, it becomes a low usage meter. Your performance in every day becomes a low usage meter. And then the old saying, if you don't use it, you lose it. It is really true. It is absolutely true. We know that not moving creates a weak brain. Your brain's a muscle, and it just needs input. It needs to be fed. So really what's happening in our less physically demanding world, when our bodies don't move, we are becoming neurologically starved. And if you're in chronic pain, if you've had long COVID symptoms right now, if you've had post-concussion symptoms, if you have a post-surgical either lumbar spine, low back, shoulder, knee, hip, and you're still having pain and you haven't been moving, you are neurologically starved or having malnutrition. And that is why you're not getting the results, because everybody's been focusing on the structural aspect. They've been putting you on a stationary bike to warm up. Then they may do a little bit of stretching. They may do some stimulation. It's not anywhere near like the ones we're going to recommend for your home use. They'll have you do some exercises. But so you know what they never did? they never really identified the true cause of your pain, and that's going to be neurological. Now, with our ARP neurotherapy, specifically our PRS, personal recovery system, I'm going to show you how you can use that unit, scan, and see where the faulty muscle or the hot spots really are. Where the muscle is broken down, they're not working as well. I'm going to show you how to do that from the comfort of your home. And then you put the pad placements on, you start doing the exercises, and we reawaken that. But before we get to any of that, I got to get you out of pain. So pain is a stiffness. There's a stiff mode. So blurry maps lead to stiffened motor control. You're not getting the information up, and so then you got abnormal movements. What happens when you have abnormal movement patterns? They become your normal movement patterns, and it can create discomfort. It can cause more loads, abnormal weight bearing. It can cause more problems with gravity on your joints and on your muscles, and it perpetuates the problem. Well, we're going to stop that. Pain is also multifactual. There's a lot into it. We know that when you have pain, you can have cognitive problems. You're just not thinking straight, right? It's hard at work to grind through when you have pain. We know it's also emotional, very emotional. It creates stress, anxiety, and even lead to depression. So when you have all those, when you have decreased sensory information or information getting up to your brain is not going to allow you to move properly. And that's going to cause a lot of conflict in your life, and maybe for the ones around you. Well, we're going to stop that for you. This is that thing I was telling you about. This is this sensory homunculus, and we know that there is a map of our whole body on the right and left side up in our brain, and it's called the parietal area if you want to get really technical. But let's say that right here in your shoulder, you've had shoulder surgery. You've gone through PT, everything seemed to be okay, but you're still in pain. When you do certain movements, you're still in pain. That's because the therapy has not been targeted to erase that blurriness in this area. That means there hasn't been a neurological input, and we can do that. And you can do that from the comfort of your own home. So in our next episode, I'm going to start to introduce our advanced therapies that we use and that you can order. You can order and get them right from your home, and then you just follow along, and we're going to show you how to use them and how to get your life back. So stay with us in our next episode where we introduce BioWave. BioWave is our number one go-to for pain. As a chiropractor, I cannot prescribe medications. Well, you know what? I don't need to with BioWave. It is unbelievable. So stay with us. I'll see you in the next episode.